Good morning and welcome to COVID-19 Talk with local health authorities. With me is Dr. David Persse, representing the City of Houston, Dr. Umair Shah, representing Harris County, at least for the next week. This is sponsored by the Rotary Club of Houston. I am Stephen Williams, the Director of the city's Public Health Department. Let's just jump right into it. Will the executive order signed on Tuesday that prioritizes Americans' access to vaccine before the U.S. helps other countries change how it is distributed?
I don't think it's changed the distribution. It'll change the amount behind it, perhaps.
That's right, yeah. So it's really designed to say that we're going to get vaccines to Americans first, at least the U.S. policy. But there are also other efforts that we talked about previously about getting vaccines to other countries around the globe. Of course, there's initially not going to be enough vaccine anywhere, and so it's going to take time for vaccine production to ramp up enough that everybody is eligible or able to get it.
Going back to our last week's question, on Tuesday, Mayor Turner mentioned a potential curfew. Might this be imposed if cases rise? Is there a magic number for this to occur? If the issue of social distancing with crowded locations and transmission can occur regardless of the time of day, what is the purpose of a curfew? New York's curfew is 10 p.m.
Yeah. So the mayor and I had a brief conversation about it, and we did not discuss, and he did not offer to me what his thoughts are in terms of a magic number or magic value. And part of it is that the mayors and judges have limited ability to take non-pharmaceutical interventions like curfews. And so with the curfew, if, for example, it's at 10 o'clock, that would probably impact the bars and clubs, which we believe are a major issue. But the earlier on in the night that you make it, the more you get into restaurants and other businesses that perhaps we don't want to impact. And so, yeah, so I don't have a magic answer to that.
That's pretty complicated.
Yeah, and one of the biggest areas of risk is actually indoor dining in restaurants, and that I think is something that continues to be an issue around the country. And so that, obviously a curfew isn't going to take care of the lunch hour or even the early evening hours.
Right, and you're right that the restaurants and eating is a risk. But if you look at some of the videos we've seen on local news, what's going on in the clubs is far greater risky behavior than what's going on in restaurants. And I wish the restaurants are back to 50%, if not less than that.
Right. Yeah, no, you're right.
Positivity rate is now 8.8%. How did we do for Thanksgiving? And what is the projection for when we will see the complete effects? Will guidelines be the same or stricter for Christmas?
So as we know, today is 2 weeks since Thanksgiving, and we say generally 2 to 3 weeks. And remember, it's not just Thanksgiving, it was Black Friday, and unfortunately, there were quite a few people that traveled as well. And so we believe that we're just starting to see the effect today and to the end of this week into the early part of next week. That's when you're really going to start to see things. But yeah, I mean, the projection is really complicated because we do know that there's going to be some bump. We just don't know how much of a bump it is. And then right as we're getting past the Thanksgiving bump, now we're straight into the holidays for Christmas and beyond. So watching it.
And we were talking about this walking in. Since the rodeo is postponed until May, is that a good indicator to when we can start scheduling our own events, like postponed weddings and fundraising galas?
Yeah, so I'll take that because I was part of that decision. So no, the May timeline really is just a question of the schedule that's available at the NRG complex. So the February-March time was universally felt to be too early for the rodeo, and there's a slot available in May where the rodeo could fit in there. So it's really just, it has nothing to do with what we think or anticipate the virus will be doing. It's because there's a spot there. So if we want to have the rodeo, wear a mask, and when it's available, get a vaccine.
Absolutely.
Texas Department of Emergency Management rapid testing pilot project. Rapid tests are being made available to some small businesses in Texas, but not near Houston. Why? Some schools were offered rapid tests in October, but not in Houston. What is the local status? I thought they were offered in Houston.
So some of the school districts have them, and they're using. And remember, when we talked about this, the amount of tests that they got was really, really small. Some of them are using them. Some of them are sort of, I will use the term experimenting. They're using them, but they're trying to see how accurate they feel that they are. So even if they used them, the total amount of tests is really small.
Yeah, and I don't know how the state made the decision about where they were going to allocate the tests for the small businesses.
Right.
Some countries are planning mass testing. Any thoughts about whether that concept would work here, since many aren't getting their free test now?
Well, you know, Both city and county health departments have been doing these different kinds of what we call seroprevalence studies to go in and get, to do testing, which is where you're not necessarily having people come to you, you're going to them in homes, but it's really giving us a very different picture on the amount of transmission there may be or infectivity there may be in the population. I'll be honest, a lot of countries have a lot of different ways that they're looking at things. I don't see mass testing. Really the question is more about mass vaccination. That's really going to be the question on the table at this point. And mass testing may have been a question 6 months ago, but right now I don't think it's as much the testing issue as much as it's the vaccination issue.
Okay, we're going to go to a question from last week that we didn't get to. Dr. Paul Klotman of Baylor said that 80% of the population not transmitting the virus because they're wearing masks and following the guidance. Some, if to 20%, just avoid parties and large social gatherings and don't disregard science. We can keep restaurants and schools open. So if the 20%, can we keep restaurants and schools open?
Well, so Dr. Klotman, is very insightful in that statement. And he's right that a lot of people are wearing masks and a lot of people are doing the right things. But we still, in spite of that, there's some percent of the population that's not following the rules. And we know this because the numbers of positive tests keeps going up and hospitalizations are going up. So basically, to answer that question, for those folks who are not following the rules today, were to start following the rules, we would see the numbers all start going down. And remind you, that's what happened in late July and August. We did that in this community. It can be done again.
That's right.
I've been postponing an elective surgery because of severe breathing issues that make me high risk. When do you project I could safely plan on going ahead with it?
Well, I think it's really, again, it's an individual discussion with the physician, right, your healthcare provider, about how important that elective surgery is or a procedure is. So we put a lot of things in categories of elective, but sometimes they're more urgent. And if you wait too long on an elective something, it can actually become an urgent or emergent issue. And so really, I think it's best served to talk through with the healthcare provider. At the same time, we also want to remind people that hospitals are safe.
Right.
So we don't want people to avoid procedures or going to the doctor if they need to.
Thank you for joining us with COVID COVID-19 talks with local health authorities. We'll be right back.
If you love concerts and live theater, going to baseball games, and eating in restaurants, inside. If you love parties and the small talk with the guy who makes you iced coffee the right way, then wear a mask. And let's beat this virus so we can get back to the things we love. Mask up, America.
Hello, Houston. Now more than ever, communication with our neighbors is critical as we work together to prevent the spread of COVID-19. It's important to get updates about resources, testing, and safety practices. Sign up for neighborhood updates to receive automated voice and text messages in English and Spanish. This new resource is available for anyone interested in receiving messages without needing a smartphone or access to the internet, especially our seniors. To subscribe to neighborhood updates, call 311 today and enroll.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Wash, washy, wash, washy, wash, wash your hands. Scrub them while you sing the song. Wash, washy, wash, washy, wash, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
Welcome back to COVID-19 Talk with local health authorities. Minute Maid testing locations uses the mouth swab. Is that also known as the saliva test? How does that compare to the nose swab for accuracy?
So I've been to that test. I go there not infrequently when I get tested. And the difference there, it is an oral swab. but it's still a PCR test. And I think that's the thing that people need, because a lot of the oral tests are not PCR. This one actually is an oral test, it's PCR. So it's very, very accurate. It's not quite as accurate as the nasal swab, but it's still highly accurate and reliable.
And they're still doing the testing there.
Yes.
Yes,
Yeah.
there. The CDC guidance on quarantine is 14 days to be sure. Our Houston and Harris County health authorities, that would be y'all, recommending that we follow that.
Yes.
Well, talking about our statement. I couldn't say that.
You got to say more than that, Umair. Come on.
So the CDC guidance remains 14 days. That's the best, and that's the gold standard. But the local health authorities, the public health authorities in this region, just issued a statement, actually just yesterday, that was really about, yes, there's confusion in the media and confusion in the communities because CDC said, well, for in certain instances, you can go to a 7-day, 10-day, and there were some stipulations about that. But really, again, the gold standard is 14 days. So we wanted to make sure to reiterate, if you can and if everything, stay with 14 days. That's the ideal. But obviously, there are some additional considerations for when you can do a shorter quarantine, but we're going with 14.
Yeah, I think this is an important point, because the other thing is that the other options that the CDC talked about have increased risk, and they document it. It can be up to 12% increased risk.
That's right.
And so, what's ironic is that, here at a time when across the nation, across the state, and Texas in particular, the numbers are rising, this is probably the worst time, in my opinion, to come up with these options.
That's right.
So,
because on the one hand, you're saying, holidays, things are bad, be careful, don't travel, and all these things. On the other hand, say, well, let's loosen the restrictions a bit, at least the way it's perceived.
Right.
And that's why you got to look at the fine print. That's why we wanted to clarify it.
And some entities have taken these options. First of all, they've classified them as guidance, and it's not guidance.
That's right.
The guidance has not changed.
That's right.
These are options under certain conditions, and they've interpreted as guidance, and others have taken them and already gone yet another step further with it and interpreted them even more loosely than they're written and made it policy. And that is a huge problem.
Right.
And I'm afraid we're going to pay a price for that.
Yeah, I agree.
Just remind us again, the local health authorities, I know the two of you, but the other counties that are involved?
Sure. So we've got a group that includes Fort Bend County. It's got Galveston County, Montgomery County. It also has some of our municipalities like the city of Sugar Land, city of Pasadena. We have our regional region, DSHS, Texas Department of State Health Services Region 65 South Medical Director that's on as well. And we've got a couple of other health authorities on as well. And then we also are joined every so often by Dean Burwinkle with UT School of Public Health. You've been on. We have other guests on at times. So it's just it's a really strong group. And we've actually been meeting 70 or 80 times since this whole thing started, twice a week. And I think one of the things that we're proud of is that on a consistent basis, we have like over 95% attendance.
Yeah,
I mean, generally, everybody is on.
Great. At a recent press conference, I heard the reproduction rate is 1.4, up from 1.1. Can you explain the significance of this? And
Yeah. So the reproduction rate is a mathematical estimate of, for every one person who's infected, how many other people do they infect? And so the magic threshold is 1.0. So anything above 1.0 means that the virus is spreading, it's accelerating. Anything less than that would mean that the infection is sort of contracting in the community. And so you're going to see that it's going to fluctuate 1.2, 1.4, 1.6, 1.3. It's going to bounce up and down because it's a mathematical thing. We have seen it over 2 when we had the real spike. And so, so we want to drive that down, but that's basically what it is.
how many people do you suspect are positive, though asymptomatic, and were never tested? Those are like 3 different questions.
Well, so our prevalence studies, which are not complete yet, and the answers aren't out, they're taking a look at that, actually.
Right. That's right. Yeah. We do know that, again, we have to, remind people that 40 to 50% of people can be without symptoms and can still spread the virus. And then that people can also be before symptoms start, 1 or 2 days before, you can also spread the virus. That's why these masks and physical distancing are important.
It's also why we have so many people who are infected, and they have no idea how they got infected.
That's right.
Okay, they test positive. Like, I have no idea how I could have. Well, you got infected by somebody who had 0 symptoms.
That's right.
And so if you look up in like on the CDC and on the web, you're going to see the value of 20 to 40% asymptomatic. And I want to remind folks that that was back in the beginning when the average person who was infected was older. The average person being infected today is much younger, and they tend to be asymptomatic much more. So that's why you're right. It's probably more in the 50% range today than it was. But if you go to the web, you're going to see that 20 to 40%, and that's a little bit outdated, I think.
And the other part, the last thing I'll say, Stephen, is that my favorite adage that people are using is, it's just allergies. And that is really dangerous when people are saying it's just, unless you've gone to a healthcare professional who said it's just allergies, you don't know. And let's be careful, and that may be exactly the person that should get tested.
So you're saying we should get tested?
That's right.
I've heard the only acceptable medical reason for not wearing a mask is the person can't remove it themselves. Is there any other reason you know? Asking because of a stubborn family member.
Yeah, if you're under 2 years of age, and really if you're unable to remove it, that's what I go by.
That's right.
Any tests been done to determine if the vaccine is safe for those who have already had the virus?
Yes, the vaccine is, so the way the tests that the trials that they've had, the way they're positioning this is that if you have been infected, you can still get vaccinated. So again, it's really designed for, look, if you get infected, you get antibodies that come on for, we don't know how long, a few months, et cetera. They wane down. You can still get vaccinated, and that's going to give you a longer immunity for a longer period of time. And we're hoping a year plus, so that we may be getting to this annual vaccination piece with this vaccine.
And the other part of that, I think the question is, we do not anticipate at this point that there would be any danger to somebody who was previously infected getting vaccinated. You should not have any increased risk of side effects or other problems.
Right. So get vaccinated.
To get vaccinated, yeah.
So get vaccinated.
So you're saying, you're pointing out get vaccinated because it may give you added protection.
That's right.
I'm saying don't be afraid to get vaccinated because there's no reason to think you're going to have any problems.
And so in unison, get vaccinated.
Get vaccinated, right.
That's right.
Okay, in 30 seconds, a Forbes article noted that if you had close contact with someone who is positive, you should keep social distance 12 to 18 feet from everyone, even wearing a mask. Is that necessary?
Look, the further away you are from someone, the better, especially indoors. End of story. I mean,
Well, if you're a close contact, you need a quarantine.
Absolutely.
And quarantine means be alone.
That's right, by yourself.
Yeah.
All right, thank you for joining us for COVID-19 Talks with local health authorities. We'll be right back.
Day after day, we set our little routines. Small things we can't forget to do, or we can't afford not to do. We embed them in our brains. We repeat. For our safety, for our family's safety. We just added a few more for everyone's safety. Remember, every time helps, every day counts. Mask up, social distance, wash your hands, get tested, don't stop, don't forget.
Oscar the Grouch here to tell you, you, to wear a mask out in public around other people. Sure, it'll keep you healthy, but more importantly, I won't have to see your happy, smiling face. And if you don't want to wear a mask, I've just got one thing to tell you. Scram! Go away!
Caring for each other because we are all in this together.
So wear a mask and have a rotten day, will ya?
Wash your hands. Avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Food. It brings us together, inspires joy, and gives us life. But we can't forget that during this crisis, over 37 million people don't have access to nutritious food. That's 1 in 12 seniors and 1 in 7 children. In fact, millions of kids aren't able to receive a free or reduced price school lunch right now. The good thing is, we can all help. Learn how you can get involved at feedingamerica.org. When we help each other, we nourish ourselves, our families, and our communities.
Welcome back to COVID-19 Talk with local health authorities. With me is Dr. David Persse, City of Houston, Dr. Umair, Shah, Harris County, for at least one more week. This is sponsored by the Rotary Club of Houston. I want to thank you to past President Kathy Finneger for providing us these questions. A bit off topic. Professor at Mount Sinai School of Medicine mentioned clinical trials starting for lifetime influenza vaccine. For this to happen, does the government have to step in and pay to fast track this vaccine?
I don't think so. No.
Not answer.
Industry will take care of that.
How many people do you suspect are positive through asymptomatic and were never tested? We talked about that earlier.
We just talked about that. The prevalence studies will tell us. They're not done yet.
That's right.
Hopefully by Thursday we will have an approval. Please update us if this decision is made earlier. Well, today is Thursday. It hasn't been made yet.
That's
right.
That's correct.
For vaccines.
Yeah.
Will the vaccine be free?
Yeah. Well,
yes and no. So the supplies, the vaccine, all that's coming free to the provider. They can charge an administration fee to the federal government, but you, the person getting the shot, shouldn't have to pay anything.
right. So the individual community member should not get charged, so please get vaccinated.
That's right.
Will both the Pfizer and the Moderna vaccines be sent to the same location for distribution? Will we know which ones we are receiving?
So it could be. Obviously it depends on how the supplies are and logistics about getting the vaccines. But yeah, the individual will be told, they'll get a card actually to return back, and that card will say which vaccine you've received.
And actually, I think it's the State Department's intent to really stay with one vaccine for one facility until that really changes. So.
Yeah. I would anticipate down the road when there are a lot more vaccines that you could have a provider that's going to have a few variety, if you will. But right now, it's going to be, you're right, one likely at the beginning.
Thought you were going to say something.
I was, but I know we're short on time.
Go ahead.
Well, I was going to say, I don't think to really, with the vaccines, as an individual, I really shouldn't have a reason to want vaccine A versus B versus C. I mean, maybe at some point we'll come up with some subtle reason, but at this point, I don't think it really matters.
That's right.
So efficacy is about the same.
Right. Right.
How do you get in the queue for a vaccine? I would like to avoid going to my PCP who charges me for a visit.
What was the question? How do you get what?
How do you get in the queue for a vaccine?
I would like to a queue. Yeah, so that's being developed.
Yeah,
we are building this car as it's going 60 miles an hour down the road.
That's right. Right now, healthcare providers, those who are taking care of COVID-19 patients, and those in long-term care facilities, staff and individuals, that's that initial group. But then beyond that, that's what's being built.
Right.
If the side effects are as strong as anticipated post-vaccine, won't people who receive a placebo in a trial know if they receive just a placebo and be stressed about getting the virus?
My understanding is that after the trial is over, they do let the individual know about placebo so that they can get protected. I mean, that is something that's in the mix, because otherwise that individual would think that they're protected and they're not. And so that would be unfair to that individual.
You're told eventually, when the trial's over, you're told what you got.
I also forgot the details of it, but I thought there was one vaccine trial which actually involved a person getting the COVID-19 vaccine, but also getting another vaccine so that they wouldn't know what they were getting because it produces similar side effects.
Yeah, that's right. There was one that was, I think it was either flu or MMR, or there was some other standard vaccine was in the control arm.
If I have already had COVID and I'm on the first priority list, should I volunteer to wait and let others go ahead of me?
It's pretty generous. I don't know that I would, though.
If I've already had COVID and
you're in the number one priority,
should you let somebody go first if you've already had COVID? I think then.
Look, the answer is maybe so, but the issue is that this is going to happen so fast over time that really at the end of the day, we're going to be, once you get into these groups, people are going to be really trying to get the vaccine. So if you can wait, yes. I mean, this is all about everybody's going to get the vaccine eventually. It's about the timing. Is it a month from now? Is it 2 months from now? Is it 6 months from now? So if you've had the COVID-19, you should have some protection. But if you had COVID-19 back in February or March, right? So you need to get the vaccine.
That's the thing. We don't know for that one individual. They have no idea of knowing whether or not they still have residual immunity or not.
Exactly. That's my concern. So I would say get the vaccine.
So you'll say get the vaccine when you come up in the
Because
queue.
here's the other thing. If you're in that top priority group, there's a reason you're in that top priority group.
That's right. That's right.
Yeah.
Okay. I know the current vaccine approval is for emergency use. When the FDA gives their final approval, will hospitals and ambulance personnel all be required to get a vaccine?
Well, that'll be up to their employer.
Yeah, so they will not be, like the federal government cannot require, and so in fact this was brought up, I was watching something last night, it was mentioned to Dr. Persse today, and really it's likely that healthcare providers are not going to be required to. Now it could be that an institution might make a policy, but even if that's the case that they're not able to, you might start to see other reasons that people want to get vaccinated. So here's an example. Qantas Airlines was indicated they're going to say you're going to need to show a vaccination in order to get on our flight. There may be other reasons why employees decide I need to get vaccinated because now I'm being restricted from doing something, and that's going to be a potential problem.
Okay. One state governor demonstrated the packaging, tracing, and mixing of the vaccine. Would you consider showing this to us next week? Well, we don't have the vaccine yet.
Yeah. Maybe not next week, but eventually we might. That's not a bad idea.
Yeah. You do a little show and tell. You have a little, you have your table here, and Dr. Persse will have his goggles on.
It all depends on which vaccine, though. Since there has been much written about the virus mutating, is there any reason to believe that vaccines will be geographically specific?
No. The virus has shown a little bit of what we call a drift, but it has not shown any major change. And so this vaccine should be effective, not just safe, but effective against whatever little bit of shifting, drifting we call it. That's
I think an important thing for people to understand is the vaccine is the mRNA vaccines are giving the genetic code to have your cells produce the spike protein, just the spike protein. It's about 2% of the whole viral genome. And it just makes spike protein. Then your body recognizes, well, that's not supposed to be here. That has not shown a lot of genetic drift.
That's right.
So we're targeting a part of the virus that is not showing a lot of genetic drift.
Okay. Stephen, can you update us on the distribution protocol? You started to talk earlier about the initial priority group, which is phase 1A, and you mentioned that it would primarily be healthcare workers, folks that are taking care of folks with COVID. We also mentioned that the 911 emergency EMS workers would be a part of that group.
Right.
Anything to add?
Well, the one that I had mentioned was that, and Stephen, one that we'll have to talk about are dentists as well, because we're talking about dentists and physicians that are in the outpatient clinics.
Yep.
We're going to have to figure out how to really get them in the queue as well.
Yeah, actually, they're coming up in the outpatient clinicians are actually in phase 1AB.
Yeah.
The second tier of phase 1A. And what's happening here is that we're looking at having folks, primarily hospitals, that get the initial vaccine really serve as an open part for some of those other folks that are in priority groups that are not going to get vaccine shipped directly to them.
Yeah, well, this is where your EVAP group comes in, and it's a group of really smart people that are tackling some really difficult problems. So I think we need to wait to hear from them.
Yeah, and really, there is a difference between what's happening in urban areas and rural areas, and so we're going to have to make sure that whatever strategy we engage in really takes into account geographical distribution.
Yep. Yeah. Absolutely. And eventually, we want to make sure that all populations within a community, race, ethnicity, minority communities, and that's also taken into consideration.
Absolutely. And David and I are actually on a work group that is looking at that too. Thank you for joining us for COVID-19 Talk with Local Health Authorities.
Say it correctly.
I am. With me is Dr. David Persse, representing the City of Houston, Dr. Umair Shah, who is going to D.C., not D.C., Washington State, and be the Secretary of Health.
That's right.
But you can't leave for another week.
I cannot leave for another week, but that's the reason why I always have an insignia, so you don't forget who I am.
Thank you to past President Kathy Fenninger, This is sponsored by the Rotary Club of Houston, and I'm Stephen Williams, the Director of the Houston Health Department. See you next week.